Most men believe that as we age, certain aspects of our health, particularly our intimate health, are just destined to decline, a silent surrender to the hands of time. But what if I told you that for many men over 60, the biggest silent harms aren't just about aging, but about seemingly innocuous morning habits that are quietly yet powerfully undermining your vitality, your confidence, and even your overall well-being? This isn't about quick fixes or magic pills. It's about empowering you with knowledge that your doctor might not tell you, concerning a very personal aspect of your morning routine. I'm Dr. Benjamin Carter, a urologist dedicated to men's health for over 3 decades, helping men over 60 rediscover their vitality and navigate this phase of life with confidence. Today, we're tackling a topic often shrouded in silence and misinformation: the dangerous morning mistakes in self-pleasure that are silently harming older men. I've witnessed countless men struggle with these challenges, often feeling alone, confused, and sometimes even ashamed. My goal is to shed light on their true causes and offer real, actionable solutions. I'm about to reveal 7 critical mistakes that most men over 60 completely overlook, yet they're absolutely vital for your urological health, your emotional resilience, and your intimate satisfaction. You've been told that certain changes are just part of aging, but I'll show you why that seemingly harmless belief could actually be sabotaging your sexual health and beyond. And make sure you stay until the very end, because I'll uncover one specific, often ignored daily habit that's silently, yet powerfully, undermining your long-term prostate health and energy levels, a mistake almost every man makes without knowing. If you're ready to take charge of your intimate health and age with strength, hit that subscribe button and tap the bell icon so you don't miss any of my doctor-backed advice. Your feedback helps me create content that truly helps men like you. Now let's dive into these 7 dangerous morning mistakes, understanding their profound physiological and emotional impacts, and then, most importantly, how to correct them. As men mature, our bodies undergo subtle yet significant changes that require a mindful approach to all aspects of health, including intimate self-care. Ignoring these changes or adhering to habits from younger years can lead to a cascade of issues. The first dangerous mistake is excessive vigor or frequency without adequate recovery. Many men, particularly in their later years, may attempt to replicate the intensity or frequency of their younger days, believing it's a testament to their continued virility. Physiologically, this can be incredibly damaging. The penile tissues, while robust, are still susceptible to micro-trauma. Excessive friction, especially when combined with insufficient lubrication or an overly aggressive technique, can lead to microscopic tears in the tunica albuginea, the fibrous sheath surrounding the erectile tissue. Over time, repeated microtrauma can contribute to the development of Peyronie's disease, where scar tissue forms, leading to penile curvature, pain, and potentially severe erectile dysfunction. Beyond structural damage, constant high-intensity stimulation can desensitize nerve endings in the penis, leading to reduced pleasure and difficulty achieving orgasm. The prostate gland, too, can experience irritation from frequent, intense stimulation, potentially exacerbating symptoms of benign prostatic hyperplasia, BPH, or contributing to non-bacterial prostatitis, causing discomfort, urinary frequency, and even pelvic pain. The vascular system, crucial for erections, can also be strained. While self-pleasure can be part of healthy vascular function, over-reliance or excessive stimulation without proper recovery can lead to venous leakage or arterial insufficiency, where blood flow to the penis is either inadequate or doesn't stay trapped long enough for a firm erection. Hormonally, while there's a transient spike in testosterone during arousal and orgasm, chronic overstimulation can lead to a compensatory downregulation of androgen receptors, potentially reducing overall sensitivity to circulating testosterone over the long term. Emotionally, the impact of excessive vigor and frequency is profound. I recall a patient, Robert, a man in his late 60s, who came to me with persistent penile pain and a growing sense of despair. He'd always prided himself on his physical strength and stamina, and as he aged, he felt a silent pressure to maintain a certain level of performance, even in his private moments. He confessed to me with a quiet shame that he was engaging in morning self-pleasure almost daily, often quite forcefully, believing it would keep his erections in shape. He'd push through discomfort, telling himself it was just a sign he was still a man. This relentless pursuit of a physical ideal led to chronic pain, which then spiraled into performance anxiety, not just in his private life, but even in his interactions with his wife, leading to a growing distance between them. He felt used up, constantly exhausted, and his self-esteem plummeted. The societal narrative that masculinity is inextricably linked to sexual prowess, often overlooking the natural physiological changes of aging, can be incredibly damaging. It tells men their experiences are abnormal, leading to isolation and a reluctance to seek help, even when their bodies are trying to tell them otherwise. This unspoken pressure to always be strong can turn a natural act into a source of immense psychological burden. To counteract the physiological and emotional toll of excessive vigor and frequency, consider integrating rest and gentler techniques. First, prioritize quality over quantity. Instead of daily, consider reducing frequency to every other day or even 2 to 3 times a week, allowing tissues ample time for recovery. Second, focus on mindful, gentle stimulation. Experiment with lighter touches, varying pressure, and exploring different areas of sensation beyond just the penis, such as the perineum or inner thighs. This can increase pleasure without increasing friction trauma. Third, incorporate warm compresses or gentle massage to the penile area after self-pleasure, which can help improve circulation and reduce inflammation. Fourth, practice sensate focus exercises even when alone. This involves focusing purely on sensory experience without the pressure of achieving orgasm, which can help desensitize the brain from the performance aspect and resensitize the nerves to lighter touch. Aim for a relaxed, mindful approach rather than an aggressive, goal-oriented one. The second dangerous mistake is neglecting proper lubrication or using irritating substances. This is a seemingly minor detail with major consequences. Physiologically, as men age, natural lubrication can decrease, particularly in the morning. When friction occurs without adequate lubrication, the skin of the penis and foreskin can become dry, chafed, and prone to microabrasions. These tiny breaks in the skin are entry points for bacteria, significantly increasing the risk of balanitis, inflammation of the glands, posthitis, inflammation of the foreskin, and even urinary tract infections, UTIs, if bacteria migrate up the urethra. Chronic irritation can also lead to lichen sclerosis, a progressive skin condition that causes thinning, whitening, and scarring of the skin, potentially leading to painful erections or even urethral strictures. Furthermore, using household products like hand lotion, petroleum jelly, or even certain oils can introduce chemicals, fragrances, and preservatives that are highly irritating to sensitive genital skin, leading to allergic reactions, chemical burns, or chronic dermatitis. These substances are not designed for mucous membranes and can disrupt the natural pH balance, fostering bacterial or fungal overgrowth. Emotionally, persistent discomfort and irritation from improper lubrication can erode a man's confidence and pleasure. I remember a patient, Arthur in his early 70s, who came to me with recurring bouts of painful penile irritation. He was embarrassed to admit he was using a common hand lotion during his morning routine because he didn't want to buy special lubricants. The constant itching, burning, and redness made him self-conscious, not only about his intimate moments, but also throughout his day. He felt a deep sense of frustration and discomfort, which impacted his mood and his ability to focus. This silent discomfort led to a gradual avoidance of self-pleasure altogether, further isolating him and making him feel disconnected from his own body. The societal lack of open discussion about lubrication needs in older men, often stemming from an unspoken assumption that natural lubrication is always sufficient, perpetuates this problem. Many men feel too awkward or ashamed to ask about it, leading them to use readily available but harmful alternatives. This silence reinforces a sense of ignorance and isolation. To ensure proper lubrication and avoid irritation, the solutions are straightforward but crucial. First, always use a high-quality water-based lubricant. These are pH-balanced, non-irritating, and easily washable. Avoid oil-based lubricants with latex condoms, though less relevant for solo activity, good general knowledge, as they can degrade latex, and crucially, they are harder to wash off and can trap bacteria. Second, apply a generous amount. Don't be shy, ensure there's enough to prevent any friction. Third, check the ingredients list of any lubricant you use. Avoid products containing parabens, glycerin for those prone to yeast infections, as it can be a sugar source, or harsh chemicals and fragrances, especially if you have sensitive skin. Fourth, consider natural moisturizers like pure aloe vera gel. Ensure it's for topical use and 100% pure, if you prefer a more natural approach, but always patch test first. Integrating these practices will transform your morning routine from a potential source of harm into a truly pleasurable and healthy experience. The third dangerous mistake is ignoring pain or discomfort as just part of aging. This is perhaps the most insidious mistake because it delays crucial diagnoses. Physiologically, any pain during self-pleasure, whether it's in the penis, testicles, perineum, or lower abdomen, is a red flag. Ignoring it can mean allowing underlying conditions to worsen silently. For example, persistent penile pain could indicate early stages of Peyronie's disease, urethral stricture, or even nerve entrapment. Testicular pain could point to epididymitis or chitis, or even a testicular mass, though rarer in older men, still possible. Perineal or lower abdominal discomfort could be a symptom of chronic prostatitis, pelvic pain syndrome, BPH, or even a hernia. By pushing through the discomfort, men not only exacerbate the immediate irritation, but also miss the critical window for early intervention. For example, treating Peyronie's disease in its early, inflammatory phase is far more effective than waiting until scar tissue has matured and caused significant curvature. Similarly, addressing prostate inflammation or urinary issues early can prevent progression to more severe symptoms or complications. Delaying diagnosis of vascular issues can lead to more advanced erectile dysfunction that becomes harder to treat. Emotionally, the man-up mentality and the reluctance to discuss intimate pain can have devastating consequences. I recall a patient, George, a proud man in his early 70s, who began experiencing a dull, persistent ache in his perineum during his morning routine. He dismissed it for months, attributing it to just getting old or sitting too much. He was too embarrassed to bring it up with his wife, let alone his doctor. The pain, however, didn't go away. It worsened, becoming a constant background hum that affected his sleep, his concentration, and his general mood. He became irritable, withdrawn, and lost interest in activities he once enjoyed. When he finally sought help, we discovered he had chronic non-bacterial prostatitis that had become quite severe due to prolonged inflammation. His denial and delay in seeking help stemmed from a deeply ingrained societal belief that men should endure pain silently, especially pain related to their intimate areas. This cultural pressure creates a barrier to care, transforming a treatable physical symptom into a pervasive emotional burden that steals joy and peace of mind. To address the grave mistake of ignoring pain, the solution is simple. Listen to your body and seek professional help immediately. First, self-awareness is key. Pay attention to any new or persistent discomfort, changes in sensation, or unusual feelings during or after self-pleasure. Don't rationalize it away. Second, do not push through pain. If you experience pain, stop, give your body a rest and observe if the pain subsides. If it persists even mildly for more than a few days, it warrants a doctor's visit. Third, be honest with your physician. Describe your symptoms clearly and without embarrassment. Remember, urologists deal with these issues every single day. Your concerns are common and legitimate. Fourth, consider keeping a simple symptom journal. Note down when the pain occurs, its intensity, duration, and any accompanying symptoms. This information can be invaluable for your doctor in making an accurate diagnosis. Early medical consultation can prevent minor issues from becoming major problems, preserving both your physical health and your peace of mind. The fourth dangerous mistake is poor morning hygiene practices, both before and after. This might seem obvious, but it's astonishing how often it's overlooked, particularly in the rush of a morning routine. Physiologically, our skin, especially in the genital area, harbors a natural microbiome. While many bacteria are harmless, an imbalance or introduction of foreign pathogens can lead to infection. If hands are not thoroughly washed before self-pleasure, bacteria from door handles, keyboards, or even residual food particles can be transferred to the sensitive genital skin, increasing the risk of bacterial infections like balanitis or folliculitis. After self-pleasure, residual seminal fluid can create a moist, nutrient-rich environment that is ideal for bacterial and fungal growth, leading to irritation, unpleasant odors, and further increasing the risk of infections. For uncircumcised men, the preputial space under the foreskin can accumulate smegma, a combination of dead skin cells, oils, and moisture, which, if not cleaned regularly, can become a breeding ground for bacteria, leading to inflammation and discomfort. Chronic poor hygiene can also lead to recurrent UTIs, as bacteria from the genital area can easily ascend the urethra. Emotionally, the impact of poor hygiene extends beyond physical discomfort. It deeply affects self-perception and intimacy. I had a patient, David, in his late 60s, who noticed a persistent, slightly unpleasant odor and occasional irritation after his morning routine. He felt embarrassed and self-conscious, assuming it was just him. This made him hesitant to engage in intimacy with his partner, leading to a quiet tension in their relationship. He also felt generally less clean and confident throughout his day, which subtly impacted his social interactions and overall mood. The societal taboo around discussing genital hygiene, especially concerning self-pleasure, means many men suffer in silence, believing their issues are unique or shameful. This lack of open conversation means that even simple, easily correctable hygiene practices remain unknown or unpracticed, perpetuating a cycle of discomfort and embarrassment. To ensure optimal hygiene, the solutions are simple yet effective. First, always wash your hands thoroughly with soap and water before and after engaging in self-pleasure. This is your first line of defense against bacterial transfer. Second, gentle cleaning of the genital area after self-pleasure is crucial. Use warm water and a mild, unfragranced soap. For uncircumcised men, gently retract the foreskin and clean underneath it daily. Rinse thoroughly to ensure no soap residue remains. Third, ensure the area is completely dry before redressing. Moisture creates a breeding ground for bacteria and fungi. A soft towel or even air drying can be effective. Fourth, consider wearing breathable cotton underwear during the day to prevent moisture buildup and promote airflow, which further reduces the risk of skin irritation and infection. These simple steps can make a profound difference in your comfort, confidence, and overall genital health. The fifth dangerous mistake is using morning masturbation as the sole outlet for sexual expression or stress relief. While self-pleasure is a healthy and natural part of sexuality, an over-reliance on it as the only means of sexual expression or as a primary coping mechanism for stress can have subtle yet significant drawbacks. Physiologically, if self-pleasure becomes the exclusive pathway for sexual release, the body may become conditioned to that specific type of stimulation. This can lead to what's sometimes called masturbatory-induced AD, where a man struggles to achieve or maintain an erection with a partner because the stimuli are different from what his body has become accustomed to. It's not a true physiological ED, but a desensitization to varied touch and a dependency on a very specific, often vigorous technique. Furthermore, if masturbation is consistently used to burn off stress, it may prevent men from exploring and developing healthier, more sustainable stress management techniques like exercise, mindfulness, social connection, or addressing the root causes of their stress. This can lead to a vicious cycle where stress builds, leading to reliance on immediate gratification, which then doesn't truly resolve the underlying tension, creating deeper, unresolved anxiety. Emotionally, this mistake can lead to isolation and a diminished capacity for true intimacy. I recall a patient, Thomas, a man in his early 60s, whose wife had been dealing with a chronic illness, leading to a reduction in their physical intimacy. Thomas, feeling the void and the stress of his wife's condition, began relying heavily on morning self-pleasure as his sole sexual outlet and a quick escape from anxiety. While it provided temporary relief, it also fostered a sense of detachment. He found himself less inclined to seek non-sexual intimacy with his wife, hugs, conversations, shared activities, because his immediate physical needs were being met in isolation. This led to a subtle but growing emotional distance in their relationship. He felt a profound sense of loneliness, even though he was physically relieving himself. The societal normalization of quick fixes for stress, combined with a lack of open conversation about emotional coping mechanisms for men, especially as they age and face life changes, can push men towards these isolated behaviors, further isolating them from deeper connections and broader emotional well-being. To diversify sexual expression and stress relief, the solutions involve broadening your horizons. First, explore other forms of intimacy. If you have a partner, prioritize non-sexual physical touch, holding hands, cuddling, gentle massages, or simply being physically present and close. This nurtures emotional connection and can resensitize your body to varied forms of touch. Second, diversify your stress management toolkit. Instead of relying solely on self-pleasure, integrate regular physical activity like walking, swimming, or yoga. Practice mindfulness meditation or deep breathing exercises. Engage in hobbies, spend time in nature, or connect with friends. These activities provide holistic stress reduction that addresses the mind, body, and spirit. Third, address underlying emotional needs. If you're using self-pleasure to cope with loneliness, anxiety, or depression, consider speaking with a therapist or counselor. They can provide strategies for healthy emotional processing and help you build fulfilling connections. Fourth, redefine sexual satisfaction. Move beyond a sole focus on orgasm. Explore sensual touch, mutual pleasure, and the emotional connection that can be profoundly satisfying. This empowers you to experience intimacy in a richer, more varied way, preventing over-reliance on any single behavior. The sixth dangerous mistake is comparing oneself to a younger self or holding unrealistic expectations. This is a purely psychological trap, but its impact can be profoundly physical. Physiologically, the mind-body connection in sexual health is undeniable. If a man constantly compares his current erection quality, stamina, or refractory period to his youth, he sets himself up for disappointment. This constant self-criticism and the pressure to perform can trigger performance anxiety. Performance anxiety activates the sympathetic nervous system, leading to the release of adrenaline, which constricts blood vessels, directly inhibiting the necessary blood flow for a firm erection. This creates a vicious cycle. Anxiety leads to erectile difficulties, which then fuels more anxiety. The emotional distress can also lead to chronic stress, which can elevate cortisol levels, potentially suppressing testosterone production over time. This psychological burden can manifest as psychogenic ED, where there's no underlying physical cause, but the mental block is significant. Emotionally, the relentless pursuit of youthful ideals can be soul-crushing. I recall a patient, Charles, in his early 70s, who was deeply distressed by the natural changes in his morning erections. They weren't as consistently firm or as frequent as they once were. He saw this as a personal failure, a sign of lost masculinity. He stopped initiating intimacy with his wife, fearing he wouldn't measure up. His morning self-pleasure became a constant, anxiety-ridden test, rather than a source of pleasure. He became withdrawn, irritable, and even developed symptoms of depression. The pervasive societal narrative of eternal youth and peak performance, fueled by media portrayals and marketing, creates an unrealistic standard for men. It subtly tells them that any deviation from youthful vigor is a flaw, leading to self-criticism, shame, and a profound sense of inadequacy. This lack of education about natural physiological changes with age means men often misinterpret normal bodily processes as failures, leading to significant emotional distress and avoidance. To counteract the insidious trap of comparison and unrealistic expectations, the solutions are rooted in self-compassion and realistic perspectives. First, embrace natural changes. Understand that changes in erection quality, refractory period, and frequency are normal parts of aging. They do not diminish your worth or your masculinity. Instead of fighting these changes, learn to adapt to and appreciate the unique pleasures of this life stage. Second, focus on intimacy and connection. Shift the emphasis from rigid performance metrics to the broader experience of intimacy, whether alone or with a partner. This means focusing on sensation, emotional connection, and shared pleasure rather than solely on penetration or orgasm. Third, practice mindfulness during sexual activity. Instead of letting your mind race with comparisons or anxieties, bring your attention fully to the present moment. The sensations, the breathing, the feelings. This can reduce performance pressure and enhance pleasure. Fourth, educate yourself about age-related sexual health. Understanding the physiology of aging can normalize your experiences and reduce anxiety. Fifth, openly communicate with your partner if you have one. Sharing your feelings and concerns can foster empathy and allow you to explore new forms of intimacy together. Remember, your worth is not defined by your erection, but by the richness of your life and connections. The seventh and final dangerous mistake is neglecting overall lifestyle factors that impact sexual health, while relying on morning masturbation for proof of function. This creates a false sense of security that can mask serious underlying health issues. Physiologically, erections, especially morning erections, nocturnal penile tumescence, are often considered a barometer of general vascular health. If a man sees a morning erection, he might conclude he's fine. Sexually, even if his diet is poor, he's sedentary, his sleep is disturbed, or he has uncontrolled chronic conditions like diabetes, hypertension, or high cholesterol. These lifestyle factors and chronic diseases silently but profoundly damage the delicate vascular system, reduce nitric oxide production, essential for erections, and negatively impact nerve function and hormonal balance. Relying on a fleeting morning erection as proof of overall health can lead to a dangerous delay in addressing these systemic issues. For example, a man might dismiss symptoms of prediabetes or hypertension because he still gets an erection. But these conditions are silently causing microvascular damage throughout his body, including the penis, which will eventually lead to severe, irreversible ED and other life-threatening conditions like heart disease or stroke. Poor sleep quality directly impacts testosterone levels and overall energy, which will eventually manifest as reduced libido and erectile function, regardless of morning self-pleasure. Emotionally, this mistake fosters a dangerous complacency and can lead to a deeper health decline. I remember a patient, Mark, a vigorous man in his early 60s, who came to me only after experiencing a mild heart attack. He was shocked, telling me, "But Dr. Carter, I always got my morning erections. I thought I was healthy." He had ignored his gradually increasing weight, his high blood pressure readings, and his nightly struggle with sleep apnea because his morning erections gave him a false sense of security about his health. He felt betrayed by his body, but in reality, he had unknowingly betrayed his body by not addressing the systemic issues that were silently progressing. The societal tendency to compartmentalize health, focusing on symptoms rather than root causes, often leads men to underestimate the interconnectedness of all body systems. They see sexual function as separate from cardiovascular health or metabolic health, when in fact, they are inextricably linked. This leads to a reactive approach to health, waiting for a crisis rather than adopting proactive, preventative measures. To avoid this dangerous complacency and truly support your sexual and overall health, you must adopt a holistic health approach. First, prioritize a balanced, nutrient-dense diet. Focus on whole foods, lean proteins, healthy fats, and plenty of fruits and vegetables. Reduce processed foods, excessive sugars, and unhealthy fats. This supports vascular health, reduces inflammation, and helps manage weight and blood sugar. Second, engage in regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week, combined with strength training. Exercise improves circulation, boosts testosterone, reduces stress, and helps maintain a healthy weight. Third, ensure adequate restorative sleep. Aim for 7-9 hours of quality sleep per night. Address sleep disorders like sleep apnea, which can profoundly impact hormonal balance and cardiovascular health. Fourth, actively manage stress. Chronic stress is a silent killer for both physical and sexual health. Incorporate stress-reducing practices like meditation, deep breathing, spending time in nature, or engaging in hobbies. Fifth, maintain regular medical checkups. Don't skip your annual physicals. Monitor blood pressure, cholesterol, blood sugar, and prostate health markers. Be open with your doctor about all aspects of your health, including intimate concerns. Understanding the interconnectedness of your body systems is paramount to true, lasting vitality. With just a few minutes of consistent effort each day, focusing on these mindful adjustments to your morning routine, and adopting a holistic view of your health, many of my patients report noticeable improvements in erectile firmness, energy levels, and overall well-being within a matter of weeks. This isn't just about physical changes. It's about reclaiming freedom, renewing confidence, and rediscovering joy. Imagine being able to engage in intimate moments with newfound confidence, feeling less anxiety, and truly understanding and respecting your body's needs. That's the transformative power of a strong body and a mindful approach, and it's entirely within your reach, regardless of age. This journey isn't just about reversing symptoms. It's about rediscovering your body's inherent strength, rekindling your vitality, and restoring a deep sense of self-worth that empowers you in every aspect of your life. You're not merely managing a condition. You're actively building a stronger, healthier, more fulfilling future for yourself. The changes you make today will ripple into every tomorrow, bringing greater joy and peace of mind. And now for the bonus tip, the final intriguing reveal that connects everything we've discussed. A surprisingly common habit that quietly affects your prostate health and energy levels while you sleep. Most men are completely unaware that prolonged bladder distension overnight or consistently ignoring the urge to urinate in the morning can silently, subtly, yet powerfully influence their prostate health. It sounds trivial, but the science is clear and compelling. When your bladder becomes overly full and stretched for extended periods, especially overnight, it places increased pressure on the bladder wall and consequently on the prostate gland, which surrounds the urethra. For men over 60, who are often already experiencing some degree of benign prostatic hyperplasia, BPH, or an enlarged prostate, this chronic pressure can exacerbate symptoms, contribute to inflammation, and potentially worsen urinary flow issues over time. It can also lead to bladder muscle fatigue, making it harder for the bladder to empty completely. leading to residual urine and increasing the risk of UTIs. Furthermore, the subconscious discomfort of a full bladder can disrupt sleep quality, even if you don't fully wake up, leading to chronic fatigue, reduced energy levels, and a hormonal imbalance, all of which negatively impact overall vitality and sexual function. Many men simply hold it until the very last minute in the morning or attribute nocturnal awakenings to age, rather than the bladder's distress signal. This seemingly minor oversight can have a cumulative negative impact on prostate health and your daily energy. The solution is simple. Hydrate adequately throughout the day, but reduce fluid intake closer to bedtime. And crucially, do not ignore the urge to urinate in the morning or during the night if you wake up. Empty your bladder completely when you feel the need. This simple habit can significantly reduce strain on your prostate and improve your sleep quality, contributing directly to your long-term urological health and vitality. You've taken the first, crucial step towards reclaiming your vitality and confidence by gaining this knowledge. Now keep going. If this video helped you understand your body better and empowered you with new strategies for health, please share it with another man who desperately needs to hear this message. Let's break the silence surrounding men's health together. Your health journey is a shared one, and by engaging, you empower not just yourself, but countless others. Don't forget to subscribe to my channel, because I'll be sharing more doctor-backed advice made especially for men like you. Leave a comment below and let me know which of these 7 insights resonated most with you, or if you have a question. I read every comment, and I'm here to support you every step of the way. Your best years are still ahead, and you absolutely deserve every one of them to be full of health, strength, and profound satisfaction.